Hi, I'm Caroline Howard, the clinical pharmacist at Carolina Advanced Health.
And I'm Kristin Langley, the on-site provider associate here at Carolina Advanced Health from Blue Cross Blue Shield, North Carolina.
And today we're going to spend a few minutes talking about how to get the best price on your prescription medications. So Kristin, from your perspective with insurance, can you tell us a little bit more about how insurance works?
Yeah, sure. So insurance typically works on what we call tier levels. So your prescription drugs, there's typically four tiers, which is your generic, which is your tier one, your preferred brand, which is tier two, your non-preferred brand, which is tier three, and then your specialty medications, which are tier four. Typically, of course, generics are the cheapest alternative, and a lot of your brand name drugs that your provider may prescribe do have generic alternatives. So I would strongly suggest, you always research to make sure if there is a generic alternative, you are using that if possible, because of course that is going to save you the most money. You can use drug search tools such as myprime.com and any drug search tool that whatever is your pharmacy benefit manager through your insurance plan. Those kind of tools do provide you a lot of useful information in how you can save money on your prescription drug costs. Caroline, so some of our patients, or there may be people that don't have insurance. Can you give them some advice on how they can save money too on their prescription drugs?
Sure. So if you don't have insurance, what you're going to be looking at is going to be the cash price for the prescriptions. So when you think about it, generic medications are always going to be a better option. So that's something to always consider about maybe switching to a generic. And that's something you could talk about with your doctor or the pharmacist where you go. Another thing is that when you're looking at cash prices for medications, that can vary a lot from one pharmacy to another. And it can be difficult information to find online. So when you get a prescription, it's worth calling around to several different pharmacies and asking them to look up the cash price for you so that you can use one that will give you the best price. Another thing you're probably familiar with are like $4 plans or like member pricing at pharmacies. Some of them you have to pay a membership fee, some of them you don't. But each pharmacy has like a different list that they use. So it's worth looking around at different pharmacies to see which list they use. Finally, something else that can be helpful is some websites such as needymeds.org. That has a list of many different medications that has coupons and patient assistant programs all in one place. You can also look on manufacturer websites to find coupons that some of them can be used multiple times. And some of them work with insurance as well to lower your copayment. So those are just some tips if you don't have insurance. But I know you've already mentioned some information about insurance, Kristin, but there's different kinds of insurance. Could you tell us a little bit more about the different kinds and how that might impact pricing?
Sure. So with Blue Cross Blue Shield and our patients here at the practice, there are two very different types of policies that we see, which are your HSA and your PPO. Your HSA is a high deductible health plan, so a lot of the time your prescriptions will apply straight towards your deductible. And of course, if you have a high deductible like $2,500, that can get pretty costly. So again, always try to go generic. Generic is going to be your cheapest option, and know your plan. So call Blue Cross Blue Shield or look at your medical benefit booklet, because a lot of times they will have some programs where there are some generics that you can get covered at 100% even with an HSA. Now your PPO plan, that is a copay plan, so you will be paying copays for your medications, although some PPO plans even do have a deductible, a smaller deductible that you have to meet prior to your copays kicking in. So again, it's all about knowing your plan, having that conversation, or reaching out on the Blue Cross websites, trying to really educate yourself to get the best cost. As Caroline said, especially with your HSA, if you are on a brand name drug, call around to your pharmacies, because they can certainly run through your insurance to give you a cost. You don't necessarily have to pick up the prescription. So call around and try to get your best price. Caroline, would you have any last bit of advice for our patients?
Yeah, I think just a good piece of advice to keep in mind is just to talk to your doctor about your financial situation and any kind of barriers you're having with cost. We always want to help people get the care they need, and knowing that if you're having financial difficulties, that could impact maybe treatment decisions, or could help us help find some tools for you, such as looking at manufacturer websites or like the needymeds.org. But we won't be able to give you that help if we don't know it. So it's really important to talk to your doctor about the cost of your prescriptions. Any thoughts from you, Kristin?
I think that's about it. Certainly, if you have any other questions for any of the staff here at Caroline Advanced Health, you can give us a call. Thank you, Caroline.
All right, thanks.